a while since you've been on the show, but, we've had a lot of folks just reaching out that, excuse me. I promise I'm not contagious, doctor. Watch this show, from time to time, or watch it all the time, but they love our conversations. They love learning more about the services that you're providing. And really, Associated Physicians Group is in just a great shape right now. It's in a great trajectory. And, from top to bottom, it seems like everyone's happy and healthy, as they can be.
We're trying to be.
Well, and today,
happy to be here.
Today we're going to be talking about this remote patient monitoring and chronic care management, which is really an interesting topic. And, as we kind of get into this, what is it? Let's just start with that in a nutshell.
Well, that's a great question, because that's really what the patient asks us. What are you talking about, right? Yeah. So remote patient monitoring, or RPM for short, and chronic care management, or CCM for short, these concepts, I think, were introduced right before COVID, about 2019. And I think the issue with uptake partly was, as we all know, COVID interrupted everything. Yeah. And a lot of things never got life. So we are basically opening up 2 new programs out of our practice, which are only being provided by about 3% of primary care practices in the country right now. Wow. And I still try to think that even though we're small, I think we have an advantage. We can move fast. Yeah. We'll be the leaders in the community providing the service. And so RPM, remote patient monitoring, basically means having technology in the patient's home for the monitoring of certain diagnoses. The main one for remote patient monitoring would be hypertension and congestive heart failure, where they have a blood pressure machine connected to a monitor. Then they report to us daily. They take their blood pressure, it comes to us electronically. We have trained staff who look at the data, and with Dr. Morrison and I, we put together the parameters that we feel require either physician notification, we have a trend or a problem, or occasionally we do have what I would call a critical value that would be so off that they would notify us, but before they even got to us, they'd say, really, you got to go to the emergency room. It's something serious. And so why do we do this? Okay. Yeah. And the demonstration projects and Medicare experience to date is that people who are enrolled in these programs have better luck getting to their goal blood pressure, which translates into a reduction in heart attack and stroke. They have fewer emergency room visits. We catch problems before the patient becomes symptomatic. Yeah. And we've already experienced a few examples of that in our own office. And at Medicare's level of interest, it's less expensive for them to support us to provide this service and prevent emergency room visits, which are expensive, and hospital days. And so Medicare is very pro RPM, because not only is it better for the patient, but it actually costs less money net by the end of the year in terms of their whole budget. Wow. So we're currently enrolling patients at a steady pace, and I'm going to say it's somewhere between 8 to 12 a week. You can't do everybody at once because our staff has to introduce them to their equipment, teach them a little bit about what they're going to do, and then they establish the routine. And a few of our patients are not initially interested in the uptake because they consider it invasive. But I think once this becomes more popular, everybody's going to.
It's incredible. This is truly incredible. And I can only imagine just throughout the years, Doctor, is that you've had individuals or you've been a part of conversations where, monitoring would have, potentially saved somebody from a critical event, or, having that, intervention step, in between, knowing that, hey, here's where the trends are going, here's what we're seeing. And you aren't going in blind every, year potentially. If you go every year to see your doctor or whenever your appointments are up. Since
we've started this, I'm convinced we've already prevented a handful of emergency room visits, or in one case, I think one of these patients would have had a catastrophic problem if we hadn't been able to get our hands on, and they felt fine. So, sometimes it's pre-symptomatic where we're trying to get this. Another group I want to highlight that might find this really helpful is if I'm an adult child of a senior patient, and just knowing that at least once a day, somebody is looking at dad's blood pressure, the security that would come to know that if something was off, somebody would call them on the phone and give them some guidance is just huge. Yeah. It's like having a guardian angel.
100%. I mean, and to me, it's a no-brainer. I mean, this truly is a no-brainer. And so what is, whenever it starts, what's that look like for the patient at home? I know that there's some steps to get through and teaching.
Well, on the RPM side, which is a completely different program, so we'll stay on that for a minute. Mm-hmm. It looks like this. You have a blood pressure cuff once a day within a certain assigned couple of hours. You go to the machine, you put the cuff on, you take your blood pressure, and it electronically goes to the database at the office. Okay. And one of our staff a human will see that and make a call. What I mean is make a decision. Yeah. They'll make a decision. Where does this fall within the parameters that the supervising physicians have given us? Okay. Fantastic. And then obviously 95% of the time it's going to be okay. But what we're looking for is those people who are pre-symptomatic and need management, or maybe they're not quite at goal and maybe it's time to, tighten up on one of them. And we've had other people where their blood pressure has been too low. They're on too much medicine. We've got to back off. So there's both ends of the spectrum here.
Well, to me, this is one of those where it helps you and the patient both, because you're truly able to see what's going on and manage this. Yeah. And now, who's the best suited candidate for this? I know that we were talking about people that were, you don't have to worry about mom and dad, and they're, taking their blood pressure. But for a patient standpoint, who are you enrolling now into this program?
Well, the diagnostic criteria, the main two would be hypertension and congestive heart failure. There are other disease states like diabetes that would qualify, atrial fibrillation would qualify, chronic obstructive lung disease would qualify, and there's probably some others out there. But these are the heavy-hitting disease states that precipitate events that lead to hospitalization or emergency room care. And of course, they're all on medication that's being monitored. So if you talk about what we call CCM, or chronic care management, that's a different protocol. Mm-hmm. And there may or may not be hardware at home, depending on that, but that's a monthly phone call from one of our staff. And what they do is they review, let's check your medication list. Are you taking your medication? Are you having any trouble getting your medication? Can you afford your medication? And we cover all that on a monthly telephone call. It's not the daily thing you see with the RPM, but what it does is it keeps patients on track. It makes sure that they're taking their medication correctly. It addresses any concerns that the patient might have. Sometimes it's not even medical, it's transportation, it's affordability. And also don't forget, your appointment is in 2 weeks on Tuesday. Yeah. And so they're more likely to make their appointments. They're getting confirmed reassurance. And some of these people, they may be on 6, 8, 10, 12 medications. It can get confusing. One might fall off the table and it's underneath the the dresser and you go over there and go, well, where's your Eliquis? Well, I can't find the bottle here.
Exactly.
Well, that's your blood thinner for your atrial fibrillation. It prevents strokes.
Right.
You don't have it. Do I need to refill it? It's on our list here. It falling off the table sounds like a joke, but stuff happens, particularly when you're taking that kind of medication every day.
1,000%. And it's so easy to do. It's not, I know so many people, when you said that, I just connected with immediately because it has happened to them.
So RPM is a daily data report. CCM is a monthly telephone call from trained personnel from our office who have to go through a specific list of concerns and questions, both of which translate into better targets in terms of whether the target's diabetic or cholesterol or blood pressure, and then reduced use of the expensive care, the hospital and the emergency department.
It made so much sense when you were talking about the insurance side of things, because if preventative care goes so much further than that emergency room stay or that intervention step, and it's so important. And as we go into chronic care management, we know how it's different now, but who typically qualifies for the chronic care management side of things?
Two chronic diagnosis and medication, which in our case, primary care, patients with multiple disease states. And again, you take any of the things we talked about in that ball of, again, hypertension, diabetes, COPD, congestive heart failure, chronic kidney disease, and I'm leaving some out, I'm sure.
It seems like this goes hand in hand pretty well together. Then it could, in a way, because of the conditions that the qualifications.
A lot of people qualify for both.
That's what I was curious about. Well, and so whenever we were talking about the support, let's go into that a little bit more thoroughly, because the medication review, I think, is so important. And I know of so many older adults in my life. We're used to one medicine that kind of has been working, and over the years, things have kind of started happening maybe that are symptoms. Someone notices it, but you don't want to change it. To have a professional opinion on that and to really take a look at what the data's, reading, is everything going right for you? That to me is one of the most important things that you could do, is that medication review.
Well, it is. And over the course of my career, we really have moved into a multi-drug management of a variety of problems. In order to get to current blood pressure goals, the average patient on antihypertensives takes an average of 2.8 medications.
Wow.
The average.
Whoa.
Okay.
So that's kind of a mind-blowing stat right there.
If you look at the protocol for congestive heart failure, there's at least 4 drugs that people take just to treat their heart failure. And then if you've got somebody who's got multiple problems, hypertension, congestive heart failure, chronic kidney disease, diabetes, you're going to end up with a list of medication that could easily approach 10. However, it sounds like a lot medication, and it is, but if you look at the outcomes, people are living longer, they're living healthier, and they're spending fewer days in the hospital. Yeah. And that's what it translates into. So living longer is one thing, but they're living more independently too. Their functional status is better. Sometimes it's a challenge getting that past the goal line with the patient to understand that I know it's a bag of drugs, but it really does make a difference.
With that being said, it's 10:25. We'll take a quick break. We'll come back with more from Dr. Green next.
Looking for the perfect camper for your next getaway? Visit Coleman's Country Campers at 2 Fun Lane in Hartford, Illinois, where families have been finding travel trailers, fifth wheels, toy haulers, and RVs since 1991. Call 618-254-1180 and let their friendly team help you find the right camper for your next adventure. From weekend camping trips to cross-country memories, your journey begins at Coleman's Country Campers, because at Coleman's, adventure starts on Fun Street.
This July, the fastest boats in the world take over the Mississippi. Catch the thrill of F1 powerboat racing, July 17th to 19th, Riverfront Park in Alton, Illinois. Speed, rivals, champions. This is more than a race. It's the Midwest National. Kicking off with the Meet and Greet Street Party, July 17th, from 6:30 to 8:30 p.m. at Max in downtown Alton. Cold beer and live music. Alton Midwest National's F1 powerboat racing, July 17th to 19th. Don't miss the action.
If you think you might be pregnant, you don't have to face it alone. At Vitality Women's Clinic, you'll find the care you deserve. We offer confidential, no-cost pregnancy testing, ultrasounds, and STI testing. Our team is here to listen, support you, and help you understand your options without pressure or judgment. Walk in or make an appointment today. Call 618-466-1690 or visit vitalitywomensclinic.org. Vitality Women's Clinic, clear answers, real support.
Welcome back. In with Dr. Chris Green, Associated Physicians Group, as we are learning more about the remote patient monitoring. Now we're on to chronic care and just wrapping up this great conversation. If you missed any of it, you can head on over to Associated Physicians Group's YouTube page or RiverBender.com /daily show. You know, going into this, as we're wrapping it up, Dr. Green, a big question is the cost. And we were talking about that. It's all covered with the Medicaid and Medicare side of things, or should be?
It depends on who your insurance comes from. So with straight Medicare, the patient has no additional cost. With Advantage Medicare plans, there may be some copay, which I think is similar to an office copay, but it depends on the plan.
Okay.
Right now, we're just rolling this out, and once we get our Medicare population situated, then we're going to look at some of the commercial payers and see what they're doing. And I'm sure it's going to depend by each insurer is going to have a different approach to this. Some of them probably haven't adopted it yet. Of course, they're taking care of a somewhat younger population. But I think the people who might be interested in this program certainly could reach out to Associated Physicians Group, establish care with one of our clinicians. And again, I think the adult child of a senior patient who might need monitoring like this may be interested, because we are the only providers in the community offering this service at this time.
It's truly important, and it's. I hope you guys really do pick up the phone and call the office, 618-509-4866, 618-509-4866. Dr. Green, it's always great talking to you, and really just appreciate the work you and your staff do.
Happy to be here.
We'll take a quick break, and we'll come back with Lacey McDonald here in a couple of minutes' time. You stay there, and I'll be here.